Improving the outcomes for patients with cancer is usually achieved by incremental steps in which new treatments are tested in controlled clinical trials by comparing the results to previous treatments. Acute myeloid leukemia is a rare type of cancer which affects infants, children, and adolescents. Difficult to successfully treat, it is the focus of a large international study conducted by the Children's Oncology Group.
The more common form of pediatric leukemia, which is called acute lymphoblastic leukemia, has seen the rates of survival going from 0 up to 90% in the last 50 years. Acute myeloid leukemia, which is the less frequent kind, hasn't been so successful, and we've only seen about 50% survival. One of the ways that we're trying to change that is to identify those patients who either do poorly as compared to those who are better risk, and give those patients who do poorly more chemotherapy and save those patients who have better chance of survival from extra therapy. This works for about 40% of the patients by using genetic markers, but the rest of the 60% of patients, we don't have a good marker.
Dr. Loken is the president and laboratory director of Hematologics. Working in collaboration with the Children's Oncology Group, Hematologics has developed a test that may be used to help classify the remaining 60% of pediatric AML patients into good or poor risk groups.
We use a technique called flow cytometry to be able to detect the surfaces of the blood cells as they pass through a laser beam. Using this, we could identify that the leukemic cells don't have the same proteins as the normal cells. We can use this to be able to detect leukemic cells in the presence of these normal cells at frequencies down to 1 in 1,000, all the way down to 1 in 10,000. What we've shown with Children's Oncology Group is that if we detect any level of these abnormal cells, those patients do poorly as compared to those where we don't detect tumor.
These previous results demonstrated to us that this assay may help distinguish which patients will require more therapy for long-term cure. And therefore, in the context of this present clinical trial, patients with MRD after their first course of therapy are receiving additional treatment. For the past 17 years, Hematologics has worked with the Children's Oncology Group to better define the role of minimal residual disease testing in pediatric AML, and has demonstrated that it can help facilitate identification of patients who will require more therapy. It's only through collaboration with researchers like those at the Hematologics that we've really been able to advance outcomes in pediatric AML, and we really are thankful to families who've agreed to participate in such studies because ultimately it's helped to improve the outcomes for children that are affected in the future.
The promise of biotechnology can only be fulfilled through the collaborative relationships between academic centers, hospitals, companies, and individual patients. Only then can the clinical discoveries be provided to patients and their families so they can make an informed treatment decision.
At this point, we're 3 months at the end of Alistair's treatment, and every blood test has come back great, and every bone marrow test has showed 0% cancer that that we've had. So we feel very blessed and humbled that our child is still alive, and she's doing great, and she's full of joy and adorable. We are just very thankful that Alistair is alive today and has been the recipient of the benefits of clinical studies that have happened in the past, and we're just very thankful for the opportunity to then in turn have her participate and hopefully help other kids be survivors as well.
Hematologics was established and is owned by scientists who wanted to understand how to use high technology to be able to detect leukemic cells in the background of normal. We started actually inside Fred Hutchinson Cancer Research Center, detecting leukemic cells in a background of bone marrow transplants. So we were predicting who was going to relapse. We use our resources, our revenue from providing these tests to be able to support our research and trying to improve the diagnostics and prognosis of those patients so we can guess or better understand who's going to do well and who's going to do poorly. Although Children's Oncology Group has been very successful at recruiting patients to be able to do clinical trials, adult studies have been very slow to accumulate patients to be able to do their studies. We want to encourage people to understand that what they are doing in participating in a clinical trial is they get the best possible treatment for that disease, but also they can help patients in the future by understanding how to better treat patients.
As the uphill fight against cancer continues, scientists who dedicate their lives to improving treatment can help level the playing field for a healthier, pain-free tomorrow. For more information, go to hematologics.com or call the number on your screen.